Thank you for joining us for another episode of the Wellness Doctor Network, where we connect the community to top-notch doctors. I'm Dr. Hollen Meyer, along with my guest, Dr. Brittany Hines. Thanks so much for joining us.
Thanks for having me.
Of course. Lots of people are seeking conservative care as their first line of defense for conditions like lower back pain, headaches, and even prevention. And chiropractic care is among a very popular choice. Today we have Dr. Brittany Hines that's going to explain to us her scientific approach to chiropractic, coupled with modalities for a very comprehensive and individualized approach. Can you tell us what you hear from folks that come see you? Why do they come see you?
Yeah, initially most people come for pain, whether it's neck pain or back pain, hip pain, knee pain, headaches, ear infections in kids, pregnancy care, auto accidents, and then they find out that we can help them with their disc bulges. They have more energy, better sleep, less anxiety, and better digestion.
That's awesome. I love chiropractic. It helps so many different things as a side effect.
Yes.
Can you tell us what makes your approach for your patients unique? What makes it so scientific and comprehensive?
So I wanted to make sure that the technique that I chose, because there are so many different ways to stimulate the nervous system and remove interference, I wanted to make sure that the approach that I took was something that I could easily explain to my patients and to my friends who are medical doctors. And so everything that we do is based off of a thorough exam as well as x-rays and posture, and very specific to each individual patient.
So Dr. Hines, can you tell us more about the specifics with the modalities that you mentioned? What actually is that and what can people expect? Give us some examples.
Yeah, so if I have patients with disc bulges, then I'll put them on the vibration traction. That was a therapy that I used at the Clear Scoliosis Institute, and it helps me get better correction faster and helps so many people with disc bulges. I've seen patients who have been told by other chiropractors that they needed surgery and got them to zero pain and completely active again with that therapy. So
that's incredible.
Yeah, and then everyone does the wobble chair or the neck tractions on the wall to get mobility into the spine, so they get a better adjustment, so they get more joint nutrients. It prevents degeneration and decay. And then we have the vibe plates that people stand on. And so we use vibration in a couple of different ways. Different vibrational frequencies affect the body in different ways. And the vibe plates actually post-adjustment helps you stimulate your neuromuscular re-education. And so it helps you hold your adjustment 3 to 5 times longer versus not using it.
That is cool stuff because not all chiropractors use these things. I love that you kind of have some modalities to prime the adjustment, and then they get the adjustment, which is the most powerful thing on the planet, I think. And then even after that, they have these other therapies and modalities to enhance the adjustment, allow it to last longer as well.
And neuromuscular re-education is really important, but the vibe plate also helps to decrease the cortisol, which is your stress hormones. It helps to balance your testosterone levels. It helps to increase bone density and helps you hold it longer.
That is so cool. That's awesome. So for many reasons, come see Dr. Hines. I know you have a lot of success stories, but can you share a success story with us?
Yeah, actually, one of my patients, Johanna, she had come in after a spinal fusion surgery. And that's one surgery that even my medical friends agree that should not happen. You shouldn't fuse anything together. But there are some other surgeries that you can do for the spine. It is common. But what happens when you fuse the spine together is that the joints above and below stop moving. So they lack nutrients. So most people within the first 5 years after having a spinal fusion have to have another surgery above or below to address the lack of motion and lack of nutrients there, because they start degenerating at an accelerated rate. So Johanna had had a spinal fusion surgery. She came in to see me afterwards after she started having some numbness and tingling in her extremities again. And so we were able to adjust above and below where the fusion was, and she didn't have to have any more surgeries. The numbness and tingling went away.
That's awesome. So she got results and it limited further degeneration.
Yes.
That's a great story that you share with us, because so many people think, oh, I've already had surgery, I'm not a candidate for chiropractic care.
Yeah, and that's just not true.
That's amazing. So do you have a special offer for our viewers today?
Absolutely. So anybody that wants to call and come in for their new patient appointment, we are offering 50% off for the first 20 people that call and mention the Wellness Doctor Network.
That is awesome and so generous. Thank you. And thank you for joining us for another episode of the Wellness Doctor Network, where we connect the community to top-notch doctors. And even within the network, we collaborate so that we can bridge the gap in healthcare. Thanks for joining me. I'm Dr. Hollen Meyer.